We've been talking about certain kinds of cosmetic surgery earlier this morning, and we have with us our special guest, and we're going to pursue this a little bit further. From the Plastic Surgery Clinic, please welcome back to the room Dr. Frank Lista.
Hi, Doctor.
Hi, everyone.
Now, Caitlin, who is quite youthful, you're not up there yet.
Despite getting called ma'am a lot recently.
Yet.
Yeah.
You've been thinking of having a little bit of something done. Maybe you'd like to explain that.
Yeah, you know, like the puffiness you get underneath your eyes? I've had that. It's hereditary. It runs in my mom's side of the family. And I've had it since I was a little kid. And it can really fluctuate with things like allergies or salt or sleep, but it's always there. They're always quite puffy and quite prevalent. Some days are worse than others. And you can conceal it with, moisturizer and under-eye concealer, but only to a point. So I thought, perhaps at some point I would consider having them removed.
And Dr. Frank Lista, what do you think of that?
Well, Caitlin and I had a 5-second consultation over here in the corner.
It was literally 5
and,
seconds.
it's a common problem. And people say, whoa, I'm only 25 years old. Why do I have this? And how do you fix it? So it's super interesting. In the past, we would have had to fix it with surgery to take the bulge out. But if you look at Caitlin really carefully, this is radio, we can't look. But anyways, if you look at Caitlin really carefully, what you see is that what she really has is a little depression on just above her cheekbone, that little valley, and that makes the bulge look worse. And so now what we do is instead of operating on it, like who's going to operate on a 25-year-old, is to fill the valley with a filler. And the most common thing is like Juvederm, hyaluronic acid, or sometimes we take your own fat and put it in there. And so without surgery, we can make it way better.
Well,
So
that's
it
much
just
easier than surgery.
Can you use
smooths
somebody else's
it
fat?
right out.
No volunteers. Sorry.
Yeah.
You don't want to give me yours?
No. Well, I would. For
You don't have any,
I
so.
would. No, I would.
And I'm sure that's a lot more cost efficient than it would be to do the surgery route and recovery time and all of that, right?
So it's way easier to do. It costs less, and there's no time, very little time off, and it's
'Cause,
super
I
popular.
I figured it would have been surgery, but there you go.
That's cool.
Exactly.
Yeah.
Is that a common thing for people Caitlin's age to come in and talk about, or what are the most common
So,
things? that
it's
people come
funny.
and
When
see
I
you
started practicing 25 years ago, the only people I was operating on for facial surgery was 40, 50-year-olds.
Yeah.
But now it's really common to see people in their 20s all the time with, lines that they don't like or irregularities that they don't like or, people want their lips done. So it's really becoming common.
And when young women especially come to you, and I do mean when they're younger like that, do you worry about the mental state at all, or do you get a pretty quick evaluation of that situation to say, no, you know what, I understand
that's
where you're
part
coming
of it,
from.
right? I mean, the person needs realistic expectations. So do they have expectations that I can meet? Do they really have something that I can fix? And are they crazy about it? Like if they say, this has ruined my life and, I can't find a spouse because of it and I can't get a job because of it, then they're not good candidates.
Do you ever advise people against it, thinking they're doing it for the wrong reasons?
About a third of the patients who come to see me, we say, either I can't really fix this, or it's not as bad as you think it is, or it's not worth doing now, maybe 5 years. So we turn a lot of, not that we turn them down, but we say, you look great right now and surgery or injections aren't ready for you. And, a lot of people, you'd think people would be disappointed about that, but they're not. They say, thanks, that's really helpful. I'm glad. You think I look okay? I'm good with that. That really is a good thing for them.
Paris Hilton is out bragging right now because her doctor just turned her down for Botox, and she's telling the world about it. She says, he says, I don't need it, and I'm quite happy with that.
Right, and she feels good about it, right? Because
Yeah.
he said to her, you know what, you look great. You don't need it right now. You look fantastic. It's not going to make you look any better. So, do it later.
Okay, so is there an age that you suggest people wait until? Whether it be something, a serious surgery, more complicated, or maybe just a slight kind of tweak here and there? Is there an age, like a cutoff age?
Well, it's not really about age, right? Like Caitlin has this thing, and you can all see it, and it bugs her. And
She sees it more than we do.
Right.
I'll say that.
And she's emotionally well adjusted,
Yeah.
right? So
Now that I know, I'm going to see it all the time.
but so
You pointed it out.
so you can't say, well, you're too young, live with it in misery for
Right.
let it bug you for another 10 years. If I can fix it and it's easy and she's okay with it and well adjusted, then let's do it. So it's not about a chronologic age. It's about, are you mature and do you know what you want and is it clear and can I fix it?
So what are maybe the top 5 things that people are coming and seeing you about? I know every time I'm in your office every week, I see a lot of people there that I know are there for cool sculpting, but,
Well, so there's, first of all, there's all the surgical things, right? So the surgical things are they haven't changed over the years, except they're becoming more popular, So those are face things like Caitlin asked about, breast, body, tummies after having babies.
Yeah.
But the big growth area now is non-surgical things like the Botox and the Juvederm and cool sculpting for fat, removing fat without surgery. We never had that technology before.
Is it true that Botox is preventative?
Yeah, absolutely.
It is?
So if you look at someone who's got the 11s, right?
Yep.
And some really young people have 11s. They're because they
just
just...
the lines on either side of your eye, just
right.
above the
So
nose.
the two up and down lines just between your eyebrows. Some young people have that, and if you keep folding your skin in that location over and over and over again, you're going to get a permanent crease there. So Botox can stop you from doing that or weaken it, so you'll never get those lines.
And
So
it's
Mom was right. You make that face, it's going to stick like that.
Yeah.
Hey, Mom was exactly right. Mom is always right.
interesting. Good
Dr.
to
Frank
know.
Lister. Good insight. Dr. Frank
Yeah.
Lister from the Plastic Surgery Clinic. Thanks for coming in. We'll see you again.
Thank you for having me.